Gvoke glucagon is a prescription medicine used to treat very low blood sugar in adults and children ages 2 years and above with diabetes. Please see important safety information at the end of this video and full prescribing information at www.gvokeglucagon.com.
I am a recruiter. That's what I do for a living.
I work for an IT department at a local high school and coach soccer.
That's actually how we met, because my sister also works there. She is a Latin teacher, and we took a trip to Italy with 20 plus kids, and Rob volunteered to be a chaperone, as did I, and that's where it all began. I'm Alison, and I'm living with type 1 diabetes.
I'm Rob. Been married to Alison for 16 years.
I was a fit 36-year-old who exercised regularly, and I noticed I was getting winded going up a flight of stairs. Then slowly I noticed I was thirsty all the time. Then, of course, was in the bathroom all the time, including throughout the night, which was irritating. And then I was also hungry all the time. And I ate and ate and ate, yet I was losing weight. And I called my oldest friend, who also happens to be a type 1 diabetic, and she said, "You need to get to the doctor right away." When I got to the endocrinologist, she cleared up any confusion and absolutely, she said, "This is type 1, and there's no question about it. This is the first day of the rest of your life as a type 1 diabetic." The endocrinologist was very direct about this being a very life-changing diagnosis, and not just for my life. My husband's life was going to change, and how incredibly serious this disease was, and how errors one way or the other, meaning letting my sugar get too high for too long, or letting my sugar not correcting if my blood sugars are dropping so low. One or both could mean coma, could mean fatality.
She was throwing so much information at us, and I don't process information coming in that quickly. So she was showing Alison how to prick her finger and read, and immediately my mind started wandering about how this was going to affect her life and my life. And then I realized I just missed 2 or 3 minutes of more important information about calculating math, about blood sugars, how fast they could go up and how fast they could go down, depending on whether it was 1 jelly bean or 3 jelly beans. I had to know this stuff as well as Alison did, or maybe even better, because there were going to be moments where Alison might not be able to take care of herself. And that was an eye-opener. That really woke me up as to how serious type 1 diabetes is.
I was in charge of all of my own administration of insulin. There's no need for Rob to do that. But she said, okay, these are warning signs that you need to be aware of, particularly if Alison is experiencing a low blood sugar. And she had no idea what kind of relationship we had, or how supportive he was, or how much we share in the responsibilities of the house. I'm fortunate that he's always been that way, but I think she also wanted him to say, hey, you're gonna need to step up in a lot of ways, even if it seems insignificant. She needs time to sort this out and to get regulated, and you're gonna need to maybe shoulder a little bit more of the load. I wasn't excited to use Gvoke because you hope you never need to, but whether it was Rob doing it or if I would have to do it by myself, at least it seemed to be just a better solution and maybe not as panic-inducing as the glucagon kit, sometimes a bit intimidating. This seemed less complex.
From a caregiver's perspective, my advice to other caregivers is the way to take the stress away from the patient with type 1. You need to shoulder some of the burden of it and be attentive to signs and symptoms of a low or a high. And if you need to take the action of using Gvoke know exactly what you're going to do. Having encountered a few of these lows and now knowing and being comfortable using Gvoke, it's a game changer for when you're in those situations, because you know that the system's going to work to relieve hypoglycemic lows.
Indication: Gvoke glucagon is a prescription medicine used to treat very low blood sugar in adults and children ages 2 years and above with diabetes. Important safety information: do not use Gvoke if you have a tumor in the gland on top of your kidneys called a pheochromocytoma because of the risk of a substantial increase in blood pressure, have a tumor in your pancreas called an insulinoma because of the risk of low blood sugar, are allergic to glucagon or any inactive ingredient in Gvoke. Stop using Gvoke and seek immediate medical attention if you experience any symptoms of a serious allergic reaction, such as rash, difficulty breathing, or low blood pressure. Before using Gvoke, tell your doctor about all the medicines you take and your medical conditions, including if you have not had food or water for a long time, prolonged fasting or starvation, have low blood sugar that does not go away, chronic hypoglycemia, or have a history of a skin rash called necrolytic migratory erythema, commonly associated with glucagon-producing tumors. The most common side effects reported in adults are nausea, vomiting, swelling at the injection site, and headache. The most common side effects reported in children are nausea, low blood sugar, vomiting, headache, abdominal pain, high blood sugar, pain or redness at injection site, and hives. Inform caregivers on the instructions for use of Gvoke and symptoms of severe hypoglycemia, which include unconsciousness and seizures or convulsions. Store in original container until time of use and at room temperature between 68 degrees Fahrenheit to 77 degrees Fahrenheit, 20 degrees Celsius to 25 degrees Celsius. You are encouraged to report side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please talk to your doctor and see full prescribing information and patient information guide for Gvoke at www.gvokeglucagon.com.